How's everybody doing today? Doing okay? Well, good. Well, it sounds like I missed something similar to this yesterday. So hopefully you won't snooze too much today. Hopefully I'll be able to give you a little bit more background. Really, I'm backwards. I should have done this the very first time I came, but I'm a little slow, so as you probably have noticed. But I'm going to back up and go start out today just going over resources that the health department offers, just in general first. That's kind of what I wanted to focus a little bit of time. So we'll just jump right into that. So just a little bit of background, how the health department works. The health department actually serves the Bear River Health District. So it's not just Brigham City, and it's not even just Box Elder County. It's actually Box Elder, Cache, and Rich counties. So you can see from the map there, they're kind of all the same color. And the health departments across the state are divided like that. Some of them will serve just one county, but many of them serve an area, kind of a district, as I mentioned. So for Box Elder County, we serve about 52,000 people, Cache about 120 plus, and Rich just over 2,000. So that's about 160,000 people that the health department serves throughout that whole Bear River Health District. And we provide a variety of public health resources, services, materials, programs, community collaboration, bringing other community agencies together. We work very closely with law enforcement, school districts. We work very closely with other social service agencies, healthcare providers, emergency response, EMS, things like that. So public health, basically, anything that's health related, and that's really broad, because a lot of times people don't really think about community coalitions as health related, but we do. We think about it as the fact of we're bringing multiple perspectives together so that we can cuss and discuss the problems in our communities, break them down, make them more manageable, because health to us isn't just about high blood pressure and diabetes. That's included for sure, but it's also about healthy state of mind, healthy lifestyles, things like that. So we want to support kind of the whole person throughout that public health process. Oh, wow, that is super teeny. Okay, so the structure of the health department, and it's not a big deal that you can't see all of these super good, but just to kind of give you an idea, there at the top you'll see some elected officials. They're part of our Board of Health. So our Board of Health is our governing body, if you will. So if the health department deems that we want to raise a class for what we're going to charge for food handlers class, we don't just up the fee. We have to go to the Board of Health. We have to talk to them about it. We have to say, you know, this is the reason why the program costs this amount. But we try to keep everything as affordable as possible. And they'll sign off, yeah, that's acceptable, that's understandable, yes, you can do that. But we go through that process so that the Board of Health are people that are from the communities, from each of those different counties from our health district, and they have a voice and a say on how we direct our public health services. So again, there's an elected official from each of our 3 counties that's part of the Board of Health, plus a variety of other people, and I'll show you that in just a second. We also have access to county attorney, auditors, treasurers, things like that. And then the Board of Health oversees our local health officer. So our big boss is still overseen by the Board of Health. So Lloyd Berenson is our local health officer for the Bear River Health Department, and he oversees our administrative services. And I'll give you a little bit more information on each of the different divisions. So that's a division of its own, and then across the bottom there you'll see that there's environmental health, preventive health, which is our nursing services, division of substance abuse treatment, and that's also mental health treatment. I'll spend some time on that today. And then division of health promotion, which is the coolest division. That's the division I work in. WIC division, and then emergency services. So we have quite a variety of things that we offer as far as public health in our community. And a lot of times when people think health department, well, let me ask you, what are some things that you just kind of automatically think of when you think health department provides what to our community? What do you think of? Yep, shots, immunizations. Yep, that's pretty common for people to, and we do that. We do that anywhere from kindergarten shots, baby shots, travel immunizations. Like I'm getting ready to go on a trip, and so what do I need? What do I need for that area? Is there anything specific that's of high risk in that area? So we do that. What are some other things you think of with health department? What did you say? Mental health. Okay, thank you. Not most people don't think of that. Most people think of Bear River Mental Health as the mental health component in our community, and they are definitely. They're the local authority for mental health. But we have trained licensed counselors on staff that do not only substance abuse treatment, but also mental health. So that's something that we're trying to actually make people aware of, because we recognize that services are somewhat limited in our area. So we want to make sure that people know that that's another an avenue of support. Thank you. Then somebody else said something else. Okay, great. Yeah, we offer a really fabulous diabetes class. It's through our health promotion division and our administrative division. They're kind of together on that project. And it's a wonderful class. It's seen a lot of success. It's pretty intense. It's a year-long class, but it's shown some really, really great results. And it's a diabetes prevention. So someone that has pre-diabetes, their sugar levels are starting to creep up there. They may have some other risk factors. They are welcome to come to that class. And we hold them in Tremont and in Brigham City and in Logan. And we are, seeing some really great success for that. So thank you for bringing that up. That's a good one. How about birth certificates, death certificates? People think of us for that. People think of WIC. That's a pretty common one that people think of. And WIC gets confused a little bit. Sometimes people think that WIC is a food stamp type of program, that it's public assistance. And while it does assist our families in our communities, it's not really a public assistance program. It's actually a program that's out of the funded by the Department of Ag. So the Department of Ag every year decides how much money they can put towards the WIC program, and if that money isn't utilized by people coming in and taking advantage of our services, that money's just lost. So we like to get that word out. And WIC has seen a little bit of a dip lately. It's kind of gone down a little bit. So we're trying to make sure people understand we still have that available resource, and I'll talk a little bit more about some of the specifics in here just a little bit. Any questions about the structure? Does that surprise you a little bit? All of the variety of the different divisions? Okay, I'm going to go through and take a minute to go through each of those, but I want to give you a little bit more information. Board of Health, again, I mentioned, is comprised of one elected official from each county. There's the list of all of those that currently serve on our Board of Health. You'll see Jeff Scott is our Box Elder County Commissioner, so he's our elected official. Jim Abel is a business owner out in the Tremont area. Dale Ward is actually our chief deputy here with the Box Elder County Sheriff's Office, and he's been on our coalition on our Board of Health, for several years now, and we've really enjoyed his addition. Craig Butters, again, an elected official from Cache County, and we have a physician you can see there. We have Sarah Sinclair. She's been a retired. She's been working in the health field for probably 50 plus years. She's on our board. We got a county attorney. And then Bill Cox is the elected official from Rich County that serves on our Board of Health. So some of them may be from familiar names, especially Dale Ward, which we have really appreciated his contributions. So the Board of Health meetings, they are public meetings. We hold those generally the second Wednesday of each month. They rotate back and forth between Box Elder and Cache County. Generally, we hold them at the health department. And you're welcome to come. You're welcome to sit in. If you have a health concern that you would like to bring before the board, we welcome that as well. And all agendas and minutes you can see there are public record as well, and you're welcome to take a peek at those. So the health department's vision is basically healthy people and healthy communities. That's what we're striving to do. As I mentioned earlier, we're trying to provide public health resources to all of our communities throughout the health district. And we try to do a good job. We understand that, and we acknowledge that there's some challenges, like going clear out to Snowville and Park Valley and Garden City. That can be kind of a challenge and kind of a drain on like resources as far as personnel and things like that. But we do try to piggyback. Like, for example, I went out with the school district. They were going to go out to do a training for school personnel out in Park Valley last year. And they said, hey, you want to come ride along? I'm like, hell yeah, let's do it. So I was able to take a bunch of health resources out. I did some suicide prevention classes out there. So there's just a variety of different things that we try to continue to include everybody. Again, we do have some challenges with that, but we try to do as best we can and to represent everyone in our district. Our mission, you'll see there's kind of threefold. It's to prevent, to promote, and to protect. So that's really what we're about, is preventing disease. So just like you mentioned about the pre-diabetes class, if we can prevent that from happening, which becomes this chronic disease that we have to manage throughout the rest of our life, if we can prevent that from fully developing, then that's quality of life improved, and that's our goal. Promoting healthy lifestyles. Our website, brhd.org, is, we just barely launched a new website, which I'm so thankful for. It's been really hard for a while because we were revamping it and trying to direct people to our services and being a little crippled that way. But check it out. We've got a whole new look, and there's a variety of different services, classes, programs, job postings, all kinds of things on there. So feel free to go on, give us some feedback if you have any concerns, or if it's confusing at all. We'd love to hear any kind of feedback. So basically just protecting the public health of our community and our environment is really our overall goal. So as I mentioned, we do try to infiltrate all the communities throughout our 3 counties. So we have multiple locations. We have the main office over in Logan, which is located behind Logan Regional Hospital, if any of you have been over that way. And we actually have another office kind of on the north end of town on 1800 North. That's our environmental health office. So that's where we do food handlers classes, and that's where emissions testing and different things like that. So we have that available. We actually have a brand new building I don't have listed here yet because it's not complete, but it should be. Contractors tell us it will be completed by July of 2018. So that means December. I don't know what that means, but we're hoping soon. But that building, we actually placed it on this one, 1300 North, is more up on the north end, as I mentioned, behind the hospital. But the new building is actually located on the south end of the valley, so it's over by Conservice, Riverwoods Conference Center. It's kind of over back behind there. And any of you that have been to our Tremont facility, it has a similar color scheme, which makes me kind of chuckle a little bit. It stands out. It's got some teal and it's got some orange. It's kind of bright, but if you say it's the building by Conservice that's bright, people will go, oh yeah, it's that one. Anyway, so we are going to have some limited resources there. It won't be everything, but we're trying just to make it more accessible for both ends of the valley over in Cache Valley. I mentioned the Tremont office. So that is a newer facility. We used to be in the police station over there for years and years and years, and we outgrew that. So we were able to build a new building. It's over by where the old hospital used to be, so it's still on that road out by the fairgrounds. And then Randolph and Garden City have 2 small offices where we have a nurse that lives out there, and she provides some limited services as well. And then, of course, the Brigham City office, that's probably the one that most of you are familiar with, just down on 8th West behind the hospital here in Brigham City. So, and again, most of our offices try to do outreach from those physical locations as well. So just be aware of that. My job is very active out in the community. Like I've shared this with you before. My best day in the office is the day that I'm not in the office. And that's quite a bit, and I enjoy that about my job, that I get to be out and about and share things with people out in the community. So come by and visit us. I probably won't be home, but come by and visit us. And I'm going to go through some of the services that we offer as well. Oh, but before I forget, another way to access us is through our crisis lines. So you can see they're listed on the screen. Fox Elder County and then Cache and Rich share a crisis line as well. And so those crisis lines, I would encourage you to put those in your phone. Again, it could be a substance abuse crisis type of situation. It could be a mental health or a public health kind of situation. You get bit by what you think is a rabid bat, feel free to give us a call, okay? Because that's something that we do surveillance on and assist with. So anyway, so I wanted to make sure that you understand that even if you can't come to one of our physical locations, there's still a line where you can call and you can have connection with trained professionals. Okay, so going back through those divisions a little bit, I mentioned administration. That's one of our divisions, and that's where our local health officer, he's out of that division. Plus then we have all of that smart stuff like budgeting and finance, accounting. You can see I abbreviated it there. HR, of course. Our computer guy, he's in there, the info technology. Vital records, so that's our birth certificates, death certificates, things like that. Which, by the way, you can now go onto our website and you can download the form to fill that out. That could save you a minute. So you can go on, download the form, and then they can start getting that ready for you so you can just drive in, pick it up, and be on your merry way. So that's something that we're trying to work on to make it a little easier for people. And public relations, that's our PIO, our Public Information Officer. They're in the administrative office as well. As far as emergency services, that division is a smaller division, but it's a mighty division. They work a lot with our EMS, healthcare providers. Are any of you familiar with Medical Reserve Corps? Have you heard of that term? So Medical Reserve Corps is a group of people that come together and plan for response. So they are generally retired health practitioners. Could be nurses, could be doctors, could be CNAs, could be whatever. But they are people that have had some kind of formalized medical training, and they are always constantly planning and drilling and practicing in case we ever have any kind of public health emergency, like if we had an earthquake or a tornado or whatever, that we would have medical people that would be emergency prepared and minded, that they could respond and assist with that kind of a disaster or crisis. Environmental health, that division, a lot of people think of environmental health and they think, oh, they're the ones that close the pools. And they can do that. They work with air quality, water quality. There's a variety of different things. Under air quality, one of their roles is to enforce the Utah Indoor Clean Air Act. So if someone is smoking in a public building or smoking right at the door of a public building, the state law is that they have to be 25 feet away from the public entrance. That's so someone with asthma doesn't have to walk through a cloud of smoke before entering a building. So if there's an infraction there and someone is violating that act, it's not necessarily the police that you call, but I mean, you could, but the environmental health component of our health department are the ones that actually enforce that. Food service, you're probably aware of that. They do restaurant inspections. They do food service inspections. So that could be at a Peach Days food truck. That could be at a 4th of July breakfast. That could be at a restaurant. That could be at a school lunch program. It could be at the jail. Wherever you're feeding other people other than your family members could be subject to food handlers' permits and things like that. Hazardous waste, so they respond if there's a oil spill or chemical spill on the freeway, things like that. Temporary mass gatherings, they make sure that people have things in place. So if there's a big group coming together, that there's porta potties available, that there's hand washing stations available, that there's crowd control, that there's not safety issues, things like that. And so I mentioned WIC earlier. WIC is comprised of a variety of things, but mostly it would be comprised of nutrition education, that monthly food benefits, that's where I was telling you where they can come in and there's qualifications, but they're actually pretty generous. Most people think, oh, I will never qualify. But most people do qualify, or many people qualify. It's generally for breastfeeding women and for children up to age 5. So it's worth checking it out. They go through that's the program that gives beans and peanut butter, formula, things like that to just aid with that, the expense of that, so that proper nutrition is available. Nursing services or preventive health services is the other name for that division. We do a variety of different health services as far as cancer screenings, immunizations you see listed there that you mentioned earlier, communicable disease, so they track like flu trends, they track bat bites like I mentioned earlier, TB cases, tuberculosis cases, STDs, they track any kind of communicable disease, and they report that to the state. They also have some home visitation and some targeted case management where they can go into the home if someone has a high-risk pregnancy or is on Medicaid and needs a little additional services. They can go in and meet with the mom, work with them one-on-one to provide them a little bit more support. We do some testing as well, yes, and that's under actually our environmental health piece. Yes, so we are involved with that. Of course, mosquito abatement is in charge of some of that surveillance as well. We've done kind of tag team with them for quite a few years. So yeah, we're involved with that piece too, which this year we've had some pretty serious cases, and we've had a lot of cases of it. And it's not entirely past the season either. So we still have that to be considerate of. And speaking of that, all of the flooding in the Carolinas, I was just hearing a news report on the radio that was talking about mosquitoes there. They now have got national funding coming in, like emergency type of funding coming in to help combat the mosquito problem because of all of the excess water. And it said that their mosquitoes are 3 times the average size. I was like, that's like a bird, right? So that can't be good. Anyway, so yes, we are involved with that as well. Speaking of immunizations, we do have flu vaccine available. So please take advantage of that. We'll have that available for some time. A lot of times people think, well, I can't get it yet. I got to wait so that it'll carry me through the season. But you really shouldn't fear that. Like, we start getting vaccine sometimes like the end of August. It usually rolls in the end of August, the first part of September. So we've had that for a while. I've already gotten my flu shot. It's important to do that. A lot of times people think if you get the flu shot, you'll get the flu. That is totally a misnomer. It is a, I see some people going, yeah, I'm not so sure about that. That don't believe it, yeah. So it is not a live virus, so there's no way you can get the flu virus from the flu vaccine because it's not a live virus that is given, and so there really is no fear of that. Now, sometimes, maybe you've been exposed to it before you get the shot, and then you come up, because there's an incubation period with that. So that's generally why that happens, is it's probably already in your system, and you're like, I better get a flu shot, and by then you've already been exposed. So, and that even if you are exposed, and it's not foolproof, it doesn't keep us from getting all flu, because it just targets certain strains, and it's not 100% effective there, but it can lessen the effects. So we do recommend that. And another thing, another immunization that is kind of exciting, if shots can be exciting, I guess, is there's a new vaccine called the Shingrix, and it's a shot for shingles. And we've had a shingle shot for quite a long time, but the shingle shot that we have had has gone through, they've now got this new one, and the old shot was about 60% effective, and the new shot's supposedly 90% effective. So that's something to think about too, because anybody that's ever had shingles, from what I hear, it's not fun. And shingle shot used to be available after age 60. It's now available after age 50. So I got that one when I got my flu shot. And it's actually two different shots. So you do the first one, and then 2 to 6 months later, you do the second one. Okay, yay, health promotion. So health promotion does a variety of different classes, programs, community collaboration. Again, we're out and about in the community quite a bit. So you can see a bunch of different prevention services for injury, tobacco, substance abuse. I came and talked to you about some of those. I didn't list suicide prevention, but we do that as well. Chronic disease education, again, that's the diabetes, healthy lifestyles, fall prevention for seniors. There's a variety of different programs. I could talk about our division all day long. We have great staff. They're really engaged in the community. So please, if you have needs, if you need something for your church group, if you need something for your community neighborhood, and you'd like to pull some people together, feel free to give us a call down at the health department. We'd love to see how we can help you. And then mental health and substance abuse treatment. So that division We, again, are the substance abuse authority in the community, which basically means that we receive funding to have things in place specifically for addiction therapy, okay? But having said that, they're licensed counselors. So they can treat addiction and substance abuse issues, just even problem use, not full-blown addiction. But they also can treat individuals, families, groups with mental health services in general. So we're just trying to promote that. We're not trying to take away from any of the other great resources that we have in the community. We have great therapists in our area, but we do recognize that there's some limitations there, and sometimes it takes a while to get in for an appointment. So this is another option. And we do work on a sliding fee scale, so our services are really quite affordable. I don't know pricing off the top of my head, but what I have been told is that we're probably one of the most affordable places to go as far as like a one-time visit, we can set up payment plans or whatever. And if there's any kind of like crisis situation, regardless if it's substance abuse related or not, give us a call, and we can always do like a one-time assessment to see if another area would be a better fit for you, or if we can get you into our services. And that initial one, if it's a crisis situation, there's never a fee for that. Okay. So when I've come before, we've talked about a variety of things. We've talked about suicide prevention. I've done some injury prevention with the seatbelt campaign and things like that. But I didn't focus a whole lot of time. We did come and do one specifically on opioid misuse and abuse. And I'm going to touch on that a teeny bit today. But I wanted to go a little bit deeper into the alcohol services. I won't spend a whole lot of time, honestly, but if you have questions or anything like that, I'd be happy to take those back, and I can always get back with Mariana and give you some follow-up information if there's questions that I can't answer. But I did want to make sure that people understand, again, that we are available in the community. And we also have a newer program. It's a couple years old now, and it's called medication-assisted therapy, which basically is counseling sessions along with medications that can assist, especially with addiction issues for alcohol and for prescription opioids in general, prescriptions or heroin or whatever, any kind of opioids. So that medication-assisted therapy has seen a lot of great results. You meet with a doctor that regulates the medication aspect of it, and then also combined with the therapy with the counselors. So that's seen a lot of success. So know that that's available in our community as well, and give us a call if you have any questions. So going into that, and I forgot to ask, I'm hoping I can get internet access. Should be able to, right? So we'll try it here. But mental health stigma is one thing that we're working with all of the other counselors and providers in our area. It's something that we just need to talk about. And I talked a little bit about this, or probably a lot about this, when I came to do suicide prevention information. But mental health, it's something that, as we start out, we all have stuff, right? Who doesn't have stuff? Whether it's stuff that happened in our past as a child, or stuff that happened last week, or if it's stuff that's happening with current relationships, or if it's stuff that's happening at work. Everybody has stuff, and we all need. That's the most professional term in the whole wide world. Sorry, but that's what it is, right? We all have things that are going on in our life that can make it difficult from one time or another, and sometimes we need a little bit more support than what we normally need. Sometimes it's calling our best girlfriend, or it's going and hanging out with the buddies on the weekend, or it's calling mom, okay, or talking to grandpa. Sometimes that's our support, and that's sufficient. But sometimes we need additional support, and that's okay too. So that's one thing that we're working on throughout the whole community with counselors and the healthcare providers in our area, is we want people to know it's okay to reach out for that support, okay? We have trained people in our community that can assist us with that. And a lot of times people say, well, I can't go to a counselor, that means that I'm weak, or that means that I don't have my stuff together. Well, guess what? We all have stuff that we don't have together at times, so it's okay. So gaining support does not mean that we're weak, does not mean that there's a character flaw. It means that we want to improve our lives. Just like when we go to the doctor. If we have a pain, or we have a problem, or we have a health concern, we go to the doctor and we take care of it. It's the same, it's just another aspect of our health. So it means that we're wise and that we're proactive and we're trying to find solutions. And it also means that we're trying to protect not only our current, but also our future happiness and health. And not only for us, but those that care about us. So if we're taking care of our physical health and we're taking care of our mental health, we're going to be stronger and more support for those others that we care about when their stuff happens, right? So I'm wondering if I'll come back to that. Let's see. So I want to just mention again, we are limited on resources. We understand that. We acknowledge that from the health department. We don't have as many resources as Salt Lake or even Ogden or probably even Cache, to be honest, over here in Box Elder County. But we do have resources, and you have some internal resources here within your agency with an EAP, your Employee Assistance Program. So tap into that. Okay, that's a phone call away. A phone call to see what type of local services you can tap into. Generally, those are where you can get in fairly quickly, and it's a great resource. So it's one of your benefits. I always say let's take full advantage of all of our benefits. I sure as heck take full advantage of my vacation leave, right? So let's do all we can. NAMI is another resource, National Alliance for Mental Illness. That's another way that you can tap in, whether you're looking for support for yourself or for a family member. So just Google NAMI, and that there are chapters that are available across the nation, and Utah is getting stronger and stronger, and even Box Elder County is getting more resources with NAMI. So just wanted to throw that out there. And of course, I've mentioned before, we have great therapists in our community. Tap into that if you can also. Okay, I'm not sure if I can get this to come up. Let's see if we can do this. Okay, but I got to do a disclaimer first. So mantherapy.org, this is Dr. Mahogany over here. This is his little logo. This is just a fun resource that's available. It's geared towards men, which men oftentimes are the ones that have the more difficult time asking for support, which stop it, okay? We all have stuff, right? So if I can get this to come up. If I can't, I really want you to go look at it. But man therapy is a little abrasive sometimes, and it's got a little bit of controversy to it, but I think it's hilarious, and I think it's a great way to open up some conversation there. So I'll just see if I can get it to come up, and we'll just take a quick peek. Like it's trying to. It's thinking. It thinks like me. It's kind of slow. Okay. How do I get it to pop over? Do you know, Mariana? So it'll change screens? You can figure that out for me. That would be wonderful. Oh, looks like it's trying to. Anyway, so just kind of a little bit of background. This is, again, just another way to show men that it's okay to ask for support. And this Dr. Mahogany, he's a little rough around the edges. And if we can get this to come up, we'll kind of scroll through, and you can just have all these little clickable links. He's got a lot of links that are geared towards veterans. Okay, so here's just what the home page looks like. Welcome to Man Therapy. As it turns out, there are worse things than being kicked in the giblets. Anyways, if you want to, so just watch this for just a second, and then I'll have you scroll down, Mariana. So you can see he's just a guy here. Let's just clean off the desk. That's how we do it, right? And he's reading his chainsaw magazine or his manual and giggling at it. I guess that's humorous and entertaining to him. So it's just funny. If you can kind of scroll through, you'll see how there's clickable links. Just kind of, run down the page there. Some of them are a little offensive. Head inspection. Okay, keep going. Don't click on anything because they might get a little dicey. I know, you got to go check it out. I just giggle all the time. But he's got some really good stuff. It like puts it in people's terms that you can use. So I know, right? This is what I'm hoping to whet your appetite here. I don't know why it's not filling in. But see, you can see, tell me about depression. Tell me about anger management. Tell me about how to process grief as a guy. Addiction. What can I do on that avenue? Is it not going to fill in down at the bottom? Okay, have I got you queued up enough that you'll check it out? Okay. All right, thank you. If you want to go back to the other, I appreciate that. Yeah, so anyways, it's just another resource, okay? And it's, you got it? So I encourage you to check it out. And again, we have counselors throughout our area that are willing to work through and help us through things. So take advantage of that EAP program. I can get it from there, that's okay. Thank you so much.
You're welcome.
Okay. So then moving a little bit more into the substance misuse and abuse. So a lot of times when we hear about therapy, we think, okay, well, I'm not an addict. I don't need therapy. I'm not an addict. I got this. Or it's not that big of a problem. But really, it's just even kind of like the pre-diabetes situation. If we can capture something and we can address it and we can learn how to manage things, why go let it get to that point, right? So misuse and abuse doesn't have to be full-blown addiction. I want to make sure that is understandable. Talked a little bit about this previously, but just wanted to quickly do just a quick reminder. With opioids, use only as directed. That's a campaign, useonlyasdirected.org, that you can visit. But it talks about 3 different types of strategies to protect us. So the first one is to speak out, and it's about empowering us to ask questions of our doctor. Does this sound familiar? Do you remember me kind of going through this a little bit? So asking them if they prescribe an opioid for you, asking, am I at risk for addiction? Like, think about your history if you've had issues in the past. Will something else work? How long will I be taking them? Are you prescribing the lowest possible dose? And what's the plan to taper me off? Studies show that we can become addicted to opioids within 7 days. So if we go to the dentist to have a root canal or some kind of oral surgery or procedure, or I'm old, a hip replaced, or having a baby, whatever, and we're prescribed an opioid, they can be effective treatment. But we also need to know that there's some dangers and risks that go along with them. So ask these doctors, have a plan in place. We don't want to put ourselves at risk. The second piece of that campaign is to opt out. There's other options. Let's explore them. Could be exercise, could be physical therapy, could be other pain management types of medications. Advil, I shouldn't say names, ibuprofen and acetaminophen. There we go, if I said it right. Advil and Tylenol, right? Combinations of those can really be helpful as well. Okay? Talk to your doctor. I'm not a doctor, so talk to your doctor about how to do that. And then the last part is throw out. When we have expired, unused medications, even some of the over-the-counter medications, but pain medications in particularly, or opioids, we need to get those out of the house. We don't want them hanging around. They put us at risk for theft. They put us at risk for misuse, accidentally taking them when we shouldn't, or getting them mixed up with something else, and they're powerful. We get them, they pose a risk for our kids getting them, curious teenagers, curious friends of teenagers, someone that's having a difficult time and they don't want to do life anymore. That gives them an option. So we want to get those out of the house. Take advantage of the drop boxes that we have. We have them in the Tremont and PD, the Brigham PD, and also Brigham City Community Pharmacy has a drop box now in our county. And then there's a whole host in other areas over in Cache. So if you go to the useonlyasdirected.org, they have a list of all of them across the state. Any questions about that? Okay, so let's talk a little bit more specifically about alcohol. So what's low risk for alcohol? What's high risk? Does our biology change, or does it determine anything about our use? And then brain changes that can occur with alcohol. Okay, so low risk. First off, let's talk about that. Low risk use of alcohol. If you're over the age of 21 and you choose to use alcohol, many people do. Many people are fine. Many people have no problems. If we're using it in a manner that is not creating problems for our health or injury or safety or whatever of other people, it's legal, something that many people do safely. But low risk doesn't mean no risk. Just keep that in mind, okay? There's always a potential risk. And depending on your biology, depending on your genetic makeup, maybe zero is the best option for you, okay? So I want to give you some low risk guidelines, okay? We talk about this in some of our classes at the health department. But if we drink 1 drink per hour, our body is able to metabolize that in a way that we're not going to become impaired, okay? So 1 drink per hour may be a low risk option for you, okay? No more than 3 drinks on any one day. If we drink more than 3 drinks on any one day, that's considered binge drinking, and binge drinking is shown to cause health effects, okay? It can cause increased risk of cancers, increased risk of cardiovascular issues, some other problems, okay? So basically, anytime we use alcohol to the point of impairment, that doesn't mean falling down. That means where we feel it, going on, changing our brain, making us feel woozy, whatever. Whenever we have any point of impairment, it starts to change the way our brain works. And it can contribute to problems, okay? Contributes to those brain changes. And it also, anytime we use alcohol to the point of impairment, it increases our tolerance to the substance. Our bodies are amazing things, right? So they learn to adapt. Our body learns to adapt and tolerate different things, okay? That's why, like, some people can drink 1 energy drink and it gives them a little boost, where other people drink an energy drink or a cup of coffee or whatever, and it, like, wigs them out for the rest of the day, right? Different people have different tolerance levels. It's the same thing with alcohol. Different people respond differently, okay? But if we use and we continue to use, that tolerance can be affected. Any questions on that? Does that make sense? Okay. So high risk. So let's talk about some specific times when it's high risk to use, even when you're not impaired, okay? If we drink to the point of impairment, it's automatically high risk. Our brain starts to change, our tolerance starts to change. But it's high risk even if we just did the 1 drink per hour and we spaced it out and drank it slow and let our body metabolize it. If we drink while we're driving, if we drink while we're pregnant, we know that it crosses that placenta barrier, and it would also be affecting the child. If we drink while we're at work, that's usually against most company policies, right? I think it's even against a bartender's policy, right? If we're under the age of 21, the younger we are, our brain's not fully developed. I would kind of argue with 21 even being fully developed, honestly. But they say that the early to mid-20s is when our brain is fully developed. And if we're using a substance that changes the way our brain works when it's not even fully developed, we are basically, potentially, I guess, compromising that development. Okay. And when we drink to the point of impairment, we have increased risk. And there are different factors that also increase the risk of us becoming impaired. So you can see there I put gender and age. So women, just in general, our body size, even if a man standing right next to me had similar height, similar weight, his structure is going to be different than mine. Just by nature, I'm going to have more fat, he's going to have more lean mass. Okay? I know it's not fair. And I'm working on the guns too, but still, it's still. But anyway, that's just how nature works. So generally, women become impaired more quickly than men. And age, if we're really young, again, that body size can have something to do with that. And then also when we're really old, these little teeny shrunken old people, they have a higher risk of impairment as well because they have less muscle mass. That muscle mass helps dilute things a little bit. If we have drugs or medication in our system and we add alcohol, it increases the risk for the impairment and being more severe. If we're tired, or we've been feeling under the weather. Our body system just isn't quite fully up to par. We have an increased risk for impairment. And you've heard this probably before. Don't ever drink on an empty stomach. That's actually true. So you have a little valve in your stomach that when you have food in your stomach, that valve closes and starts the digestive process, okay? If you don't have food in your stomach and you're drinking, that volume of liquid goes straight to your small intestine. And that's where most of our absorption takes place. So if we eat something, the flapper valve is closed, it starts the digestive process, starts those enzymes and all of that good stuff going on in our gut, in our belly, and then it slowly releases into the small intestine to be absorbed. That's how we get our nutrients. If we're drinking alcohol on an empty stomach, again, it goes straight to the small intestine, we absorb it faster, and we have a quicker effect. We're going to become impaired quicker. So if we're going to a party and we're going to have a drink, or we're going out to dinner, you notice in the state of Utah where you have to sit down and eat something, that intent to dine, that's another way of it's a safety precaution that put something in your belly first. So biology does affect your consumption of alcohol. There's a lot of research through Sweden, the States, multiple other countries, but the Sweden adoption research is really, really fascinating. And it talks about if we have a family history, a parent, a grandparent, a sibling, a close relative, if we have one of those people in our life that either has drug addiction or alcohol addiction issues, or even problem use, we increase our risk for addiction ourselves by 4 times. Our initial tolerance, how well we do with alcohol initially, like the very first time we use it, can be affected by our biology. And again, we may respond differently to alcohol or other substances just based specifically on just our genetics. So if we know that there's a family history, or if we've had a history, we need to talk to our kids about that. We need to let them know that they're at an increased risk. They may respond differently and they may have problems quicker. So risks of alcohol impairment, again, I mentioned brain changes. These are some of the brain changes that can occur with alcohol impairment. I'm not talking addiction, I'm just talking becoming impaired. It can increase our tolerance, as I mentioned. It can affect how our memory works, short-term memory and long-term memory, but generally short-term memory at first. Blackouts, which is not the same as passing out. A blackout is where somebody still appears to be awake and functioning, but they have so much chemical, so much alcohol in their system that their brain does not store memory for a period of time. So they may be at the party dancing on the table or driving and be in a crash and never even have any recollection that they put themselves behind the wheel. Definitely relationship difficulties, and I will link that one to domestic violence. Most of domestic violence situations involve some type of impairment. Most of the time people are not going to reach out and hurt someone that they love. But if our brain is not quite fully functioning and it's had some changes and we're under the influence, then that's generally when those kinds of things happen. Lack of focus. So lack of focus while we're using, but not only that, but like the next day, especially after a heavy drinking episode, the next day we can feel a little cloudy, we can feel a little foggy, not be able to concentrate quite as efficiently. And then again, a risk of impairment is addiction. So again, just to kind of finish up, Health Department, brand new website, please check it out, give us some feedback. We also have a mental health resource directory that lists a bunch of the different support groups, counselors in our area, crisis lines, things like that, so check that out. And then on our new website, we have classes, events, we have prevention materials. Again, I've offered up our services through the Health Promotion Division. Give us a call. Some other great resources, Healthy Relationships, Family Place, Parents Empowered. I mentioned that one in a previous presentation that I did. And that's the one that focuses on getting parents some skills to assist with prevention strategies for their kids. And then Kids Health. It seems kind of weird to be promoting that one, but it's got some really great stuff. They have like a kid component where kids can go and look at what do I do about acne? What do I do about being embarrassed about body odor? Like all kinds of weird kid things. great kid things. I shouldn't say weird kid things. But then also parents, like, what do I do if I can't get my kid to sleep through the night? To what do I do if my kid doesn't come home at night? So a lot of different resources there. And again, wanted just to reiterate one more time, the crisis lines for both of our areas. Feel free to give those a call at any time. And those are listed on our website as well. And that wraps up today. Is there any questions or any services that you're wondering if we can help with or that we currently provide?
The wells and the septic permits, correct?
Yes, environmental health does that as well. Yep. They go out, they do like the perk testing if we're going to build a home, and you have to dig a hole and see how well the saturation levels are for your area, so they know if you can do a septic tank or you can, whatever, see what your options are. And then also testing wells and the water quality for that. So if you're building a new home or you're digging a new well, you can give us a call. We have a form that you fill out, and you can bring in a water sample, and we can get that tested for you. Yes. Unfortunately, we do not have anything along those lines, which I'm right there with you with a parent with Alzheimer's myself. I have personally found great support with the senior center. They have a lot of resources. So that's another core function of health promotion. Our division is to be a little bit more aware of other agencies and what they provide, so we can link people to services if we don't provide it. So senior care, again, the senior center is great in town, and also Bragg has some senior resources as well, as far as even things like if they're still living in their home and need assistance with heat or needing a new roof replaced or things like that can be very catastrophic for our older generation, just their safety and their well-being. So, anything else? Any other questions or comments? Alrighty, you guys all have a great day. Thanks for letting me come again.